Member for Kelowna Mission.
Thank you so much, Honourable Speaker. And I don't know what the Minister was just talking about, because Kelowna General Hospital sits this morning at 137% occupancy with 103 ALC patients. No deviation whatsoever. So I don't know about this preparation for the fall, but it certainly isn't trickling down to the interior. In fact, my constituent in Kelowna was just told that her mother, who she cares for, has cancer and only has 6 months to live. But when she went to get an appointment for her mother with an oncologist, she was told that her mom's not going to be able to be seen for 3 months. So that means that the 6 months that they've got left with her mom, half of them are going to be spent sitting on a chair at her house waiting for an appointment. She says, and I quote, "I have called, I have begged, I have pleaded, I have explained the situation that she doesn't have long, and I can't get anything done until we get into the cancer clinic," end quote. How many more families will have to suffer through the last days of their lives because they are stuck on a cancer waitlist under this NDP government and this Minister of Health?
Minister of Health.
Honourable Speaker, of course, and I don't speak about individual cases, but when members want to bring individual cases to my attention, I personally look into them. I think they know that. I think they know that, Honourable Speaker. But I would say, Honourable Speaker, that what is required in our cancer center system is the kind of investments we're making, taking away a centralized system and ensuring that there are new cancer centres in different parts of British Columbia, Honourable Speaker. It's why, for people in Surrey, when we're building a new hospital in Surrey, something that should have happened a decade ago, we're also building...
Members. Minister of Health has this floor.
We're also building, Honourable Speaker, a new cancer centre. I would hope that members of the opposition would support that. Honourable Speaker, well, the Leader of the Opposition, as always, takes these matters very seriously. But I think, Honourable Speaker, what is required is exactly the kind of investment in screening and support we're providing. Our healthcare system is and has been in the midst of 2 public health emergencies, and it has responded, Honourable Speaker, with resources and courage that are second to none. And we have to continue to do that. We absolutely engage with individual patients who have struggles in that healthcare system to make sure they get the care they need. And sometimes, let's face it, that can be a challenge. But our teams are working with people everywhere. And the strong investment in cancer, not now, but in the last number of years, helps in that regard and will continue to help, Honourable Speaker, as we address these issues over the next 10 years when we are expecting a significant increase in the number of people living with cancer because of increases in our population over 75. So what that requires is a Health Human Resources plan. We've put one in place. More nurses, we're hiring more nurses. We've hired 38,000 net new healthcare workers over the time I've been Minister of Health. We need to do it again. And that means exactly the kind of investment and teamwork that went into our agreement with doctors this week, exactly the kind of work and effort that went into our working with the BCNU on security, Honourable Speaker, exactly the kind of investment that went into our work with the HEU on long-term care. We need to continue that work.
Members.